Hi everyone, welcome to the Diploma in Optometry e-Taster class. My name is Miss Chua and together with my colleague Mr. Wu, we're just going to share with you what is refractive errors and how do we correct for refractive errors. So, like we mentioned earlier, what exactly is refractive error? Let's find out in the next few slides. Before we talk about what is a refractive error, we will need to ask ourselves what gives rise to normal vision. In a normal eye, parallel rays of light are bent by the cornea and lens to form a focus exactly on the retina. This gives rise to perfect vision. So, what is refractive error? Refractive error is an eye condition in which parallel rays of light fail to come to a focus on the retina. In other words, the light rays are not properly refracted. There are three major types of refractive error. Number one, myopia. Number two, hyperopia. And last but not least, astimatism. Let's move on to find out more about our first kind of refractive error, myopia. So, myopia is the most common kind of refractive error that we find, especially in Singapore. What happens during myopia? Where is the light focused with respect to the retina? In a myopic eye, the light is focused in front of the retina, and people with myopia cannot see distant objects clearly, while near vision is not affected. This is very commonly seen in us when we remove our glasses and we find that the vision for distance is blurry. What causes myopia? Myopia occurs when the eyeball is too long or the curvature of the cornea or lens is too steep, meaning the refractive power of the cornea and lens is too strong. Next, we want to find out about hyperopia. So, in a hyperopic case, where is the light focus with respect to the retina? In a hyperopic eye, the light is focused behind the retina. People with hyperopia have difficulty focusing on near objects and in extreme cases are unable to focus on objects at any distance. So what causes hyperopia? Hyperopia is the exact opposite to myopia. Hyperopia occurs when the eyeball is too short or the curvature of the cornea or lens is too flat, meaning the refractive power of the cornea or the lens is too weak. The last type of refractive error that we talk about is astimatism. So, what is astimatism? In an astigmatic eye, the cornea has an abnormal curvature. The light rays enter the eye unevenly, resulting in the formation of multiple focal points. So what causes astigmatism? Astigmatism occurs when the cornea or lens is not evenly curved, thus having an irregular shape like a rugby ball instead of a football. This picture shows us the difference between a spherical eye and an astigmatic eye. If you look at the picture on the left, it is a spherical eye whereby it looks like a basketball, where the horizontal and the vertical has the same curvature. Whereas in an astigmatic eye, it will look like a football, where the horizontal and the vertical has a different curvature. So, what is the effect of astigmatism on vision? In an astigmatic eye, vision for both distant and near objects appear blurry or distorted. There are some cornea diseases or pathology that can cause high astigmatism. And one typical example is keratoconus. Keratoconus is a degenerative disorder of the eye that causes the cornea to thin and change from a dome shape to a conical shape. This picture shows the comparison between a normal cornea and a keratoconic cornea. Note, if you look at the picture on the right, you will realize that the cornea itself looks more cone in shape. Ever wonder how do we treat keratoconus? One very useful way of treating keratoconus is through the use of contact lenses. Rigid gas permeable, also known as hard lenses, or specially designed rose-K lenses are useful for mild keratoconic patients. However, if the keratoconus is more severe, then corneal transplant or replacing the entire cornea might be required. Now that we have found out about the three major kinds of refractive errors, let's find out from Mr. Wu how do we correct for this refractive error. Over to you, Mr. Wu.
Thank you, Ms. Chua. Hi everyone, this is Mr. Wu here, and I'm going to bring through the rest of the lecture with you guys regarding corrective aids and also the refractive surgeries. So the corrective aids is not, I'm not going to talk about the spectacle glasses where most of you will be familiar with. We're going to talk about contact lenses. And for contact lenses, there are actually two main kind of contact lenses. The more common ones is actually the soft contact lens, and the least common one, but is still available in the market, is actually RGP lenses. They are also commonly known as rigid gas permeable lenses. So for the soft contact lenses, they are comfortable, they are easy to adapt to because they are comfortable, they are actually cosmetically appealing. As you can see at the bottom, it does come with different colors, but it doesn't mean that all soft lenses actually comes with colors. There are actually soft lenses that comes without colors as well. And they are, you can see from the right hand side of the picture with the eye on it, they are actually soft lenses. They are non-colored with, if anything, very, very slightly tinted. But the tint is not for cosmetic reasons, but it's more for handling reasons. So, so essentially, they are more cosmetically appealing because it comes in different colors. And also at the same time, it does come with options where it can make your eye looks bigger. So most teenagers are actually pretty into this kind of lenses. But having said so, soft lenses are a little bit more prone to infections. But despite it slightly more prone to infections, the number is still relatively low. There is actually a study done by Stapleton in 2008, and what the study says that actually for soft lenses, the rate, or rather the incidence of contact lens complications, is only 4 per 10,000 wearers. So in percentage, it's actually a very low number. It's actually a 0.04%, which is very, very low number. So, but at the same time, infections are mostly caused by improper use of contact lenses and not because of the inherent use of contact lenses. It's more towards the point where people tends to wear them longer than usual, tends to use them in a manner where they are not supposed to, like they go for swimming, or they use solutions that are not meant for such lenses, or they don't use new solutions, or they don't clean the lenses properly. That actually increases the rate of infection. So essentially, these are actually soft contact lenses. They are comfortable, easy to adapt to, cosmetically appealing, but slightly more prone to infections. For RGP lenses, which is a rigid gas permeable lenses, they are also available in the market. Not commonly known. The reason being is because the take-up rate of such lenses is a bit low because of the lens awareness. Unlike soft lenses where you have a soft piece of plastic, rubbery, light plastic that's going to be on your eye, this RGP lenses is, as the name suggests, is rigid. It's actually going to be stiff. You don't really see them flexing around, or you don't really feel that it flex around. It's basically a small hard piece of plastic that's going to be on the eye. Because of that, when you blink, the lens actually does move a little bit more as compared to soft lenses. It doesn't hug around the eye like soft lenses. It moves around, and because of that, you have a bit of lens awareness on top of the inherent nature that it being a bit more rigid. And because it does move around, when it's not fitted properly, it dislocates more easily because it doesn't wrap around like a soft lens. And again, unlike the soft lens, it's slightly more difficult to remove the lenses because it requires a little bit of handling skills. But of course, if the practitioners like optometrists, who's going to prescribe you with RGP lenses, they're going to train you good enough, well enough, so you're able to handle the lens properly and competently. As compared to soft lenses, they are a bit less prone to infection. In the same study by Stapleton in 2008, as compared to soft lenses, you have 4 in every 10,000. The rate of contact lens complication, or the incidence rate of contact lens complications in the same study is actually 1.4 in every 10,000, or rather 1.2 in every 10,000. Sorry for that. So in 1.2 for every 10,000, it will have equals to 0.0112%. So it's actually a very, very low number. The reason being it being slightly lower number as compared to soft lenses is because of two things. One is because it moves around, there's a lot higher oxygen flow and there's a lot higher in terms of tear exchange. So therefore, if there's going to be any harmful microorganisms, or if there's going to be any things that's going to stuck in between the eye, tears are going to be flushed through them pretty easily, and that's not going to be trapped, unlike the soft lenses. The another reason why there is slightly having a less prone to infection is because being almost very low or 0% in terms of water content, um, it doesn't attract, it doesn't, it's actually not in an environment where microorganisms like to thrive in, because it's not wet. And because of that, um, the risk of having eye infections through the RGB lenses is a lot lower. And RGB lenses these days are more fitted for a few reasons. One is because it's able to correct mild cases of keratoconus, like what Ms. Tra has mentioned previously. Two is for people who wants to have long hours of comfort. Now, you might think that, hey, how come Mr. Wu is saying that there's going to be lens awareness, there's going to be RGB lenses is going to be uncomfortable, and yet I'm talking about long hours of comfort. Soft lenses, the initial comfort is there, but if you're going to wear them for like 10, 12, 15 hours, towards the end of the day, the lens tends to dry out and the lens tends to be not performing at its best. And with that, comfort is going to be a bit lower, and at the same time, your vision is going to be affected. But for RGB lenses, once you got used to them after a month or two, they'll be just as comfortable, if not more comfortable, than soft lenses. And that comfort, at the same time, the vision clarity will carry through with the consumer or with you throughout the rest of the day. So the two reasons why people want to wear RGB lenses mainly is because if they have very mild form of keratoconus, one. Two is that they are able to wear contact lenses for longer hours with better comfort and with better clarity. But of course, there are specialty lenses which are able to correct like more complicated cases where someone who have gone through refractive surgery, where they have a piece of their tissue in their eye being removed because of their refractive surgery, and but that refractive surgery didn't end up as well as what it was supposed to go, and yet the person doesn't want to wear glasses for the remaining refractive era. So with that, they cannot wear soft lenses because the surface of the eye has been altered, and they would actually need to wear RGB lenses to correct that. That's actually a post LASIK or post refractive surgery keratoconus, not keratoconus, post refractive surgery RGB lenses. So that is for RGB lenses. Next, we're going to talk about the contact lenses being advantage and disadvantages. The advantages of contact lenses as compared to glasses generally is that you have a wider field of view, and because of that, it's very suitable for certain occupations, like if you're going to be a pilot, maybe with very mild form of refractive error, you're going to be an air steward or air stewardess, or if you're going to be in the military forces, or you're going to be a sportsman. Okay, having a wider field of vision and having not having a pair of glasses sliding down your face would be potentially advantageous. It's going to be convenient because unlike glasses, it may not. I mean, it doesn't really fall off that easily. It doesn't fog up or slide down your nose. And for the disadvantages is that as compared to glasses, they are slightly more prone to having infection, and it might not be available for all prescriptions, especially for people with extremes, like for example, if you have astigmatism of a very, very high level, or if you have myopia of a very, very, very high level. So it might not be available for you. But of course, there are also a specific range of contact lenses that are more custom made, which might be available for you. So if you want to find out more about that, you can talk to our optometrist or you can talk to us regarding that. And the pictures that you do see over here, they are actually complications of having eye infections. On the top left hand corner is actually a cornea ulcer that would have been potentially caused by contact lens overuse. or having the cleaning of the contact lens not done appropriately. Next, what you can see on the right hand side on the top is actually on the upper lid, you do potentially have this condition for called GPC, meaning it's giant papillary conjunctivitis, and it's actually small little bumps, or not actually small little bumps, it's actually kind of large bumps that's happening or that's growing on your upper eyelid, and that actually causes a bit of discomfort when you blink. You're gonna have a bit of discharge, you're gonna have a bit of itch and stuff like that. Okay, and at the bottom is actually a more advanced case of having a corneal ulcer, or a very advanced case of a new blood vessels that's going to be grown into the center of eye because of lacking of oxygen. And apart from the contact lens that we have talked about, another option for you to have your refractive error being corrected for your myopia, for your hyperopia, also and for your astigmatism being corrected is through refractive surgery. And there's actually three main types of refractive surgery, three main types, but of course they're actually smaller subtypes. We are not going to talk about that today. The three main types is going to be LASIK, epi-LASIK, and phakic intraocular lens implants. And for LASIK, basically is a very common procedure that is being done throughout the world. I would say the huge percentage of refractive surgery that is to correct your refractive error is done via the LASIK method. And what it does basically is actually two steps, or in fact three steps. One is that a flap is going to be created, okay, and then laser is going to be shine onto your eye, or laser is going to be onto your eye, and some of the tissue is going to be burnt off. In the but how much tissue is going to be burnt off and what manner is going to be burnt off, it depends on the refractive error, or how much myopia, how much hyperopia, or how much astigmatism you have. And then lastly, after the burning off of the tissues has been done, the flap will be covered back, okay? And this is basically LASIK. So I repeat, LASIK is a refractive surgery that corrects your hyperopia, your myopia, or your astigmatism, depends on what you have to a certain level. And what it does is that first, it creates a flap, or what the surgeon does is that they will actually create a flap, and then laser will be performed onto your eye to burn off part of your cornea, and then the flap will actually be replaced back, okay, or rather being put back, and that would be LASIK. The good thing about LASIK is that it's pretty fast, it's pretty comfortable to a certain extent because there's a flap, so the area of exposure will be pretty much minimized, and there's going to be somewhat like a wow effect where straight after the surgery the patient can more or less regain a huge part of their vision almost immediately. They can see pretty well almost immediately after the surgery, and the recovery is going to be pretty fast. That is the main advantages of LASIK. But the downside of LASIK is that you need to have a certain amount of corneal thickness before LASIK can be done, because you need to have a flap being created. But there are some individuals with high levels of myopia or high levels of refractive errors that LASIK is not able to cater to because of the need to have a flap, and because of that they will need to go through a second type of refractive surgery called epi-LASIK. So over here, I'm going to play you a video of how the epi-LASIK is going to be done. So let's go.
This patient is undergoing epi-LASIK in their right eye. This is a Moria epi-LASIK epitome. The suction ring is being placed on the eye. Firm pressure is applied before the suction is turned on. The machine will tell you when you've got good suction, and I ask the patient if the light is dimming out. Once they say the light's dimming out and I've got good suction, I then add some fluid to the surface and then go to position 1 on the epitome petal. The position 1 is a rather slow position, and we will see coming up on the right side of the screen the beginning of the epithelium coming up into the epitome right there. Once the epithelium comes up, I go to position 2, which is a little bit faster. And I remain on position 2 until the blade reaches about the center of the cornea, at which point I can go to position 3 on the foot pedal until I reach the end. There, the microkeratome has reached the end. I then release the suction and remove the epitome from the eye. The epithelium sometimes remains in the epitome, but here the epithelium has remained on the cornea with a mild hinge nasally. I check the surface of the cornea to make sure it looks smooth, which it does, and then I remove the residual epithelium. I then dry the cornea, increase the laser magnification to 1.6 on the Vizx S4 laser, center the laser treatment, set the tracker, and do the ablation. Once that's complete, I then place an ice popsicle on the cornea to cool it down, after which I often use mitomycin C 0.02% for 12 seconds on the corneal surface. Once that's done, I irrigate the corneal surface with 30 cc's of cold saline. After that, I use some antibiotic, steroid, and non-steroidal medication drops, along with a bandage contact lens. At which point the procedure is complete.
Okay, welcome back. So for this epi-LASIK, also known as a superficial LASIK, there is also a flap being created, but this flap is a lot thinner as compared to the flap that's actually being created as compared to the one being created by the LASIK, the normal LASIK. And with that, the LASIK for the epi-LASIK requires, the requirement for people having an epi-LASIK being done is having a smaller or thinner cornea. So people will actually go through this because they have not enough a thin cornea. And also at the same time, people who would not be eligible for a normal LASIK because of certain occupations they have, like for example, if you are a fireman, or maybe if you are in a certain vocation in the military forces, or if you are a pilot, if I'm not mistaken, you can't do you can't do LASIK because of the flap, and there's a chance that the flap might be dislodged, although a very small chance, but there's a slight chance that the flap might be dislodged in the future. But for epi-LASIK, there isn't such a flap being created, and therefore the risk of a flap dislocation in the future will be almost next to nothing. So the last procedure is the phakic intraocular lens implant. This is not very common. This basically is a lens that's going to be implanted into your eye itself, and that is like it's like a contact lens, but it's not on your eye, but in the eye itself. And it is placed in front of the pupil or behind the pupil, depends on the procedure that you prefer to go through. And the reason why this is not very common is that people will typically go for LASIK or epi-LASIK because they are a bit less invasive, because there's nothing done into the eye as compared to this. But why would people actually choose this procedure is because sometimes the prescription that they have or the degree that they have for myopia is like very high. It's like 1,005, 1,006, or they have very high levels of astigmatism, which is like 500-600. And or in our terms is 5 or 6 diopters, and that amount or that level of astigmatism, of that level of myopia, a normal LASIK or normal epi-LASIK is not able to cater to. And with that, people actually go through this procedure, phakic intraocular lens implant, and to have the refractive error being corrected. So we have actually reached the end of our e-taster. Hope that you have liked our e-taster video. And if there's any questions, please feel free to ask us at the end at the Q&A section. So see you later. Bye everyone.